Surgery, a carefully choreographed dance between precision and expertise, relies heavily on a vast array of specialized tools, surgical instruments. These instruments are the unsung heroes of the operating room, extending the surgeon's hands and enabling them to perform intricate procedures with accuracy and control. Imagine a surgeon as a conductor leading an orchestra, and the surgical instruments as the instruments. Each instrument plays a crucial role, working in harmony to achieve a successful outcome. Just as a violin produces beautiful melodies, a scalpel makes precise incisions. And just as a trumpet delivers powerful notes, a retractor provides the surgeon with a clear view of the surgical field. From the familiar scalpel to the more specialized laparoscopic instruments, each tool has a unique purpose and function, contributing to the overall symphony of surgery. Understanding the basic categories of surgical instruments and their specific uses is essential for anyone interested in the world of medicine. This exploration into the realm of surgical instruments will delve into the most common types, providing a glimpse into their functions and importance in various surgical procedures. Whether you are a curious mind eager to learn more about the medical field, or a prospective medical student, this journey promises to be both insightful and fascinating. Cutting instruments are the workhorses of surgery, used to make incisions, dissect tissues, and remove unwanted growths. They come in various shapes and sizes, each tailored for specific tasks within the operating room. The most iconic cutting instrument is undoubtedly the scalpel, a small handheld blade used for making precise incisions. Scalpels can have different blade shapes, such as rounded or pointed, depending on the desired cut. Think of a scalpel as a surgeon's pen, allowing them to draw the lines of an incision with precision. Scissors are another essential cutting instrument used for both sharp and blunt dissection. Surgical scissors come in various forms, such as Metzenbaum scissors, which have delicate blades for cutting through thin tissues, and Mayo scissors, which are heavier and used for cutting thicker tissues or sutures. Imagine these scissors as specialized fabric shears, each designed to cut through different types of materials with accuracy. Grasping instruments, also known as forceps, are essential for holding and manipulating tissues during surgery. These instruments act as extensions of the surgeon's fingers, providing a firm grip on slippery or delicate tissues. One common type of grasping instrument is the toothed forceps, which have small teeth that interlock to securely hold tissues. These forceps are often used for grasping skin or fascia, providing a secure hold during suturing. Imagine them as tiny, precise pliers gripping onto tissues with just the right amount of pressure. Another important type is the non-toothed forceps, also known as smooth forceps. These instruments have smooth tips, making them ideal for manipulating delicate tissues without causing damage. Surgeons often use smooth forceps for handling organs or blood vessels. Think of them as delicate tweezers, gently holding and manipulating tissues with care. Hemostasis, the process of stopping bleeding, is crucial during surgery. This is where hemostatic forceps, also known as clamps, come into play. These instruments are designed to compress blood vessels, effectively controlling blood flow. One commonly used hemostat is the Halsted mosquito forceps, a small, delicate instrument used to clamp off tiny blood vessels. These forceps are especially useful in delicate procedures where precision is key. Think of them as miniature clothespins clamping down on small blood vessels to prevent bleeding. For larger vessels, surgeons turn to heavier hemostats such as the Kelly clamp. These clamps have longer jaws and a stronger grip, allowing them to effectively control bleeding from larger arteries or veins. Imagine them as larger, more robust clamps, similar to those used in woodworking but designed for controlling blood flow. Section 5. Holding things back. Retractors and their importance in surgery. Imagine trying to navigate through a dense forest without being able to push aside branches and leaves. This is the challenge surgeons would face without retractors, instruments designed to hold back tissues and organs, providing a clear and unobstructed view of the surgical field. Retractors come in various shapes and sizes, each tailored to specific surgical needs. Handheld retractors, such as the Army-Navy retractor, are manually operated by the surgical assistant, providing dynamic retraction during surgery. These instruments are like an extra pair of hands for the surgeon, holding back tissues to expose the surgical site. Self-retaining retractors, such as the Vitelaner retractor, have a locking mechanism that keeps them in place, freeing up the surgical assistant's hands for other tasks. These retractors are like adjustable clamps, holding tissues apart to create a clear working space for the surgeon. Section 6. Tying up loose ends, suturing instruments and wound closure. Once the surgical procedure is complete, it's time to close the incision or wound. Suturing instruments are specifically designed for this purpose, enabling surgeons to meticulously stitch tissues back together. The needle holder, as its name suggests, is used to hold the suture needle securely during suturing. It provides a firm grip on the needle, allowing the surgeon to make precise stitches. Think of it as a specialized pair of pliers designed to hold and manipulate the suture needle with accuracy. Surgical suture comes in various materials, such as absorbable sutures that dissolve over time and non-absorbable sutures that need to be removed later. The choice of suture material depends on the type of tissue being sutured and the desired wound healing properties. Imagine these sutures as specialized threads, each with unique characteristics that make them suitable for different types of closures. Section 7. The importance of sterilization. The importance of sterile instruments in surgery cannot be overstated. Surgical instruments are sterilized to eliminate all forms of microbial life, including bacteria, viruses, and spores. This is crucial to prevent surgical site infections, a serious complication that can delay healing and threaten the patient's recovery. Sterilization methods include high-pressure steam, dry heat, and chemical solutions. Each method has its advantages and disadvantages, and the choice depends on the type of instrument and the facilities available. Maintaining the sterility of surgical instruments is a paramount concern in every operating room. Surgical teams follow strict protocols for handling and sterilizing instruments, ensuring patient safety and minimizing the risk of infection. This meticulous attention to detail underscores the critical importance of sterility in the surgical environment. Section 8. Beyond the basics, specialized instruments and their applications. While the instruments discussed so far represent the foundation of surgical instrumentation, numerous specialized instruments cater to specific surgical disciplines. For instance, laparoscopic surgery, a minimally invasive technique, utilizes long, slender instruments inserted through small incisions in the abdomen. Laparoscopic instruments, such as graspers, scissors, and staplers, are designed to operate within the confines of the abdominal cavity. They often have specialized handles and mechanisms that allow for precise movements and manipulation of tissues. Think of them as miniature versions of traditional surgical instruments, adapted for use in minimally invasive procedures. Another example is robotic surgery, where surgeons control robotic arms equipped with instruments from a console. Robotic surgical instruments offer enhanced dexterity and precision, enabling surgeons to perform complex procedures with minimal invasiveness. Imagine them as extensions of the surgeon's hands, controlled remotely with incredible accuracy and control. Section 9. Conclusion. The indispensable role of surgical instruments. Surgical instruments are the unsung heroes of the operating room, playing a vital role in countless medical procedures. From making the first incision to closing the final suture, these instruments are extensions of the surgeon's hands, enabling them to perform intricate procedures with precision and care. Understanding the different types of surgical instruments, their functions, and their importance in various surgical specialties is essential for anyone involved in the medical field. This knowledge not only enhances communication and collaboration within surgical teams, but also highlights the critical role these tools play in saving lives and improving patient outcomes. As technology advances, we can expect further innovation in surgical instrumentation, leading to even more precise, minimally invasive, and effective surgical techniques. The future of surgery is bright, and surgical instruments will continue to play an indispensable role in shaping that future.